Hi there, how are you today? Wonderful. My name is Dr. Matt. I'm going to do your cranial nerve exam. Before we begin, I would like to verify your first and last name and your date of birth. Okay. Perfect. Okay, so go ahead and tell me a little bit about what's going on, what brings you in, and why do you need a cranial nerve exam? Okay. Wow, okay, I see. So you went unconscious, you woke up, you were in a puddle of blood. Okay. I'm so sorry about that. I'm glad that you're doing well now, but I will definitely have to do a very thorough investigation of all 12 cranial nerves. Is that okay? Great. Okay. Do you have any allergies? Allergic to penicillin? Okay. Are you taking any medications on a daily basis? Okay. So you've been taking Tylenol every 6 hours. Got you. And can you please show me exactly where you hit your head? Okay. Are you experiencing any blurry vision, any double vision, any peripheral vision loss? Okay. Any changes in your smell or taste? So a lot of the things have changed, that's for sure. Okay. Are you having any pain right now? And on a scale of 0 to 10, how would you rate your pain? Okay. And are you experiencing any tingling sensations or numbness? Were you seen by a practitioner right after the accident? So you did go to the ER. Okay. Yes, hence the referral from the ER doctor. I see here that they did a CT and an MRI of the brain and they didn't see any internal bleeding. That's good. Okay. Any fractures? No. Perfect. Okay, so let's go ahead and begin your exam. Okay, so the first thing that I'm going to do is to check your facial sensation, check your face and your scalp. Is that okay? Okay, so I'm asking for permission to come a little bit closer and to touch your head. Great, thank you. I see. And behind. Okay, so you're having lots of pain over here. Okay. Can you please close your eyes and tell me if you feel this? Okay, what about this? Okay, and what about this? Oh, did you feel that equally on both sides? Okay, I'm gonna go ahead and pinch your face very gently. Keep your eyes closed and tell me while you feel this. Good. What about this? Good. What about this? Okay. What about here? Okay. And here. Okay. So as I'm looking at your face, I'm noticing that there is no droopness, no cyanosis around the mouth, and your face is very symmetric, which is a good indication of no fracture. I'm gonna go ahead and perform a test which is called dull or sharp, And can you please extend your palm? Perfect. So this is what sharp feels like. Great. And this is what dull feels like. Perfect. So I'm going to go ahead and ask you again to close your eyes. And please tell me if this feels sharp or dull. Sharp. What about now? Sharp. What about now? Good. What about now? Okay, perfect. What about now? Good. And what about now? Okay, wonderful. I'm going to apply some pressure on the bony prominences, and this is the utensil that I'll be using. Now go ahead and close your eyes and again tell me where exactly you feel the pinch. Perfect. Keep your eyes closed. Perfect. Okay. Good. Perfect. Good. Okay, wonderful. Okay, I'm going to go ahead and take your oxygenation. Can you please extend your index finger for me? Good. Okay. And take a deep breath in and just relax. Okay, your heart rate is a little bit elevated, 106, but your oxygenation is very normal, 98 percentile on room air, so I'm not concerned. Okay, I'm going to take your blood pressure. Do you have a preference on which arm? This one? Okay, let's go ahead and just put your... Good. And if you don't mind, can you hold this for me? Perfect. Okay. Your blood pressure is a little bit elevated. I'm not sure if it's intracranial pressure that is causing your blood pressure, but that is definitely not normal. And I know since you're not my first time patient that your blood pressure normally is a little bit lower. Your blood pressure is 150/89, so your systolic is a little bit elevated. Let's go ahead and check you further, okay? I'm gonna go ahead and check your mouth next. Can you please give me a big ah? Okay. So gag reflex is intact. I'm not noticing any deviation. Everything is symmetric. Can you please open your mouth and stick your tongue out just like this? Okay. And now move it up and down for me, please. Good. And side to side. Excellent. Can you please push with your tongue inside your cheek? Like that. Okay. Same thing on the other side. Okay, good. Can you please smile for me? Good. Now frown. Perfect. Can you please puff your cheeks and keep them puffed for me? Just like that. Good. Okay, can you please shrug your shoulders? Good. And close your eyes. Okay. Don't let me open your eyes, okay? Perfect. And now can you please open your eyes as wide as you can, just like this, and I'm gonna try to push down your eyebrows. Don't let me do that. Good. Okay, perfect. Let's go ahead and check your taste. Since you did notice that you're mixing the taste, like sweet with salty and salty with sweet, then I definitely want to make sure that we have a proper assessment. So I'm going to put one drop on your tongue. Can you please extend your tongue? Good. Perfect. Can you please tell me if that is salty or sweet? Sweet. Okay. And let's go ahead and try one more. Can you please tell me if this is salty or sweet? Salty. Okay. And let's go ahead and try one more. Can you please tell me if this is salty or sweet? It's bitter. Okay. So everything looks good there. Alright. I'm gonna go ahead and check your nose next. First, I think I need to palpate it, okay? Make sure that you are not having any pain since you did hit your nose a little bit. So go ahead and relax. Any pain while I do this? No, good. I'm going to obstruct one ear. Can you please breathe in, breathe out through your nose? Good. And I'm going to do the same thing on the other side now. Please breathe in, breathe out through your nose. Okay, so both ears are patent. Now I'm going to go ahead and just take a look inside your nose. Can you please look up for me? Good. Okay. And I'll do the same thing on the other side. Look up for me. Good. Okay. So I'm not noticing any obstruction. Mucosa is pink and moist. Everything looks good. Let's go ahead and check your smell. Okay, so can you please identify the smell for me? Okay, close one nostril, I mean. Good. And can you please tell me what this smells like? It smells like roses. Exactly. Okay, let's go ahead and try one more. Can you please tell me what this smells like? It smells like vanilla. Okay, so that looks very good. Let's go ahead and check your ears next. Now, I know you said you're experiencing some pain. Is it in the right or the left? Right. Okay, so it's this one. All right. Well, first, I'm going to take a look inside your right ear. Okay, let me know if you experience any kind of pain while I'm doing that, and if I am causing you pain, then just, we'll stop. Okay, so go ahead and look that way for me, please. Okay. I'm definitely seeing some redness on this side, but otherwise nothing too crazy. Okay, let's go ahead and check your other ear now. Okay. Same thing on this side. Looks very normal. I'm not seeing anything abnormal. Tympanic membrane is intact. No fluid leaking. Okay. I'm going to go ahead and check your hearing. I'm going to do a test with a tuning fork. So I'm going to create a sound. Please tell me when you don't hear the sound anymore, okay? Now, okay, let's do that on the other side. Tell me when you don't hear the sound anymore. Now, okay. Now, can you please close one ear for me? Okay, so we're gonna close this one and tell me when you don't hear the sound anymore. Now, okay, and same thing on the other side. Tell me when you don't hear the sound anymore. No, okay. Can you please close your eyes? Good. I'm going to make some sounds. Tell me with which ear you hear the sound, okay? Okay. Good. Okay. Now go ahead and close one ear. Okay, I'm going to say some words in your other ear that is not closed. Can you please repeat those words back? Mad B ASMR. Perfect. I want my tingles back from you. Okay. Coconut. Okay, good. Rainbow. Okay, so it looks like your hearing is intact. Let's go ahead and check your eyes next. Okay, for that I'm gonna have you look straight in my nose. Okay, and I'm going to shine a bright light in your eyes. I apologize in advance. It's going to be just for a few seconds. Okay. Okay, keep on looking at my nose. Good. Keep on looking at my nose. Good. Keep on looking at my nose. Good. Keep on looking at my nose. Okay, great. Keep on looking. Keep on looking. Good. Keep on looking. Good. Okay, let's go ahead and have you trace my finger with your eyes only. Don't move your head at all, okay? Good. Perfect. Okay, I'm going to bring this a little bit closer. Go ahead and follow my finger. Good. Good. Okay, and I'm going to move a little bit farther. Go ahead and follow my finger. With your eyes only, don't move your head. Okay, let's go ahead and check your peripheral vision. I'm going to ask you to tell me when you don't see my fingers in your field of vision. I'm going to bring my fingers very close to your eyes. Okay. Now good. Now good. Now good. Now good. Alright, so we're both going to cover one eye, and I'm going to bring my fingers in your field of vision. Tell me when you see them, okay? So go ahead. I covered the right eye. No, I covered the left eye. You covered the right eye. Okay, perfect. Let's go ahead and begin. Now, good. Now, good. Now, good. Now, good. Let's go ahead and switch eyes. Good. 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 Okay, perfect. Can you please tell me what color this is? Red. And what color is this? Yellow. Perfect. So let's go ahead and follow the red ball without moving your head, and try not to let yourself distracted by the yellow ball. Okay, so go ahead and keep on looking at the red ball. And at some point, you will not see the red ball anymore. Then that's okay. Okay, perfect. And we're going to do the same thing again. Keep on following the red ball. Perfect. Good. And at some point, you're going to lose the red ball. Okay, great. Okay, I'm going to have you cover one eye. Great. And with your left hand, perfect, I'm going to have you hold this. Okay. Actually, it's okay. I'm going to hold it for you. This is perfect distance. Alright. So let's go ahead and try to read some of these letters. Can you please tell me what letter this is here? Good. And what's the next one? Okay. And what's after that one? Good. And this one. Good. And this one. Okay. Can you please tell me what number do you see right here? 2. And what number do you see right here? Okay. And what about this letter? Okay. Let's go ahead and switch eyes now. Perfect. I'm going to hold it for you. Can you please read the last row starting with the last letter? H, B, you please tell me what color this is? Good. And what color is this? Okay, perfect. What number do you see right here? Mm-hmm. And what number do you see right here? Okay. And which number is bigger? 6 or 7? They're both the same. Perfect. Okay, I'm gonna go ahead and check you for color deficiency. Very easy test. I'm gonna have you first cover one eye. Okay. And can you please tell me now, what number do you see right here? 8. And what number do you see right here? 6. Perfect. Okay. Now go ahead and cover one eye. Good. Okay. And can you please tell me what number do you see here? Great. And what number do you see here? 29. Perfect. Okay. Can you please trace this number for me? Perfect. And can you please trace this number now? Okay, wonderful. Alright, I'm gonna have you look right here behind me, straight at the wall, and I'm going to come very close to you, and I will look at your optic nerve. Okay, so go ahead, keep on straight. Good. Okay. Optic nerve is intact. I'm not seeing any abnormalities. Everything looks very good. Let's go ahead and check your other one now. Same thing. Keep on looking here behind me. Okay. Same thing. Everything looks very good. Okay, I'm gonna go ahead and check your muscle coordination now. So can you please touch your nose and then touch my finger? Okay, only with your right hand. Go ahead, touch your nose and now touch my finger. Good. Touch your nose and now touch my finger. Perfect. Touch your nose and now touch my finger. Good. Touch your nose and touch my finger. Okay, perfect. Touch your nose and touch my finger. Perfect. Let's go ahead and switch. Same thing. Touch your nose. Good. And now touch my finger. Good. Touch your nose. Now touch my finger. Perfect. Touch your nose. And now touch my finger. Perfect. Touch your nose. And now touch my finger. Okay. And I'm gonna have you do after me, okay? I'm going to do it first and then I'll just show you and you do it, okay? So just flip your hand like this. Back and forth. Can you do that for me? Back and forth. Okay, let's go ahead and switch. Very good. Back, forth, back, forth. Perfect. Looks very good. Can you please extend your arms just like this? I'm going to try to push them down. Don't let me do that, okay? Good. And I'm going to try to open them. Don't let me do that. Good. And now I'm going to try to lift them up. Don't let me do that. Okay, good. I'm going to do the same thing to your legs and your feet. Because you're sitting down on a chair, I'm going to have you just lift one knee up, okay? Good. And the other one. Okay, perfect. I'm going to go ahead and just tap on your bony prominences and make sure that your reflexes are intact. For that, I'm going to have you relax your jaw. Okay? So something like this. Good. Just a little bit lower. Relax. Good. Perfect. And now I'm going to move down the body. Just relax. You don't have to do anything. Good. 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 Perfect. Same thing on the other side. Okay. Alright, so I'm going to give you some muscle relaxants, okay? That's definitely going to help with the relaxation and to decrease the pain that you're having. I'll give you 350 milligrams of that twice a day. Just make sure that you take it in food because it might upset your stomach a little bit. And also, try not to drive after you take one medicine, especially at night. It's going to make you very sleepy. I mean, not extremely sleepy. You'll still be able to work and function normally, but maybe just driving at night will be kind of not safe. Okay, I'm going to go ahead and just sign this and I'll send it electronically to your pharmacy. Do you have any questions for me? Okay, wonderful. Well, thank you so much for allowing me to do this cranial nerve exam on you. I'll see you back next time.